New Johns Hopkins study finds that fewer than 20% of organ transplant patients generated an antibody response to the first dose of the COVID vaccine. That preliminary study raises questions about vaccine protection for not only those patients, but for others with weakened immune systems. That also includes people with HIV, AIDS, cancer patients, people taking medications for rheumatoid arthritis, lupus, ulcerative colitis, inflammatory bowel disease, and people on steroids, among others. And joining us to talk about the COVID vaccine and people with a compromised immune system is Dr. Michael Angarone, Associate Professor of Medicine and Infectious Diseases at Northwestern University's Feinberg School of Medicine. Dr. Angarone, thanks for being here. So this study, only around 20% effectiveness after the first shot in immunosuppressed patients versus 85 to 95% in healthy patients. What does this mean about the efficacy of the vaccine in those patients?
Well, thanks for having me here, and that's an important question. And this study really looked at just the response to the vaccine with antibody levels after the first dose. And so we don't really know how efficacious or less efficacious the vaccine will be, but it does kind of raise our concern for those people who are immune suppressed or immune compromised. May they not respond as well to the vaccine and still be at risk for acquiring coronavirus infection?
And we mentioned who fell into those categories. So what would you anticipate a study after the second dose showing?
So we're hoping that after that second dose, we're going to see an increase in the numbers or the percentage of individuals that have an antibody response. And then I think more importantly, looking at how many of those individuals become infected with coronavirus, whether or not they develop the antibody. So we know that there's other arms of the immune system that protect us, and antibodies are just one marker of that.
And is this true with other vaccines, say the flu vaccine, that is less effective in immunosuppressed individuals?
Yes, and that's one of the things that we've been worried about, is that when we look at other vaccines, we know that people with immune suppressed conditions or on medications that suppress the immune system, they don't respond as well to other vaccines, influenza, pneumonia, hepatitis B, etc.
Does this mean that immunosuppressed individuals might want to wait before getting vaccinated or shouldn't be in such a hurry to do so?
I think we still should promote getting vaccines for everyone, including those that are immune suppressed. So this study does not tell us that it's not safe. The vaccine was safe in these individuals. This study just tells us that the immune response or that immune globulin response was less. But we still want our immune suppressed individuals to get vaccinated. We want their family, the people that they're around, to get vaccinated. This study does not mean that we should halt or slow down the vaccine rollout for those immune suppressed individuals.
And say that further studies show that indeed immune suppressed individuals don't respond to the vaccine the same way that healthy individuals do. What does that mean for return to normal for them? Does that mean they might have to be quarantined longer, wear masks longer than the general population?
And that might be what we have to do. We might have to start thinking about those individuals. That's one of the reasons behind, even after immune competent individuals or the general public get vaccinated, that we still are promoting wearing a mask and distancing until the pandemic really gets under control. We don't know who's immune suppressed. And so those people that we're around every day might be immune suppressed. So we need to protect them. They need to protect themselves. And they may indeed need to wear masks and distance and kind of take those precautions for longer than the rest of us, or start thinking about the different things that they're getting involved with a little bit differently, at least until the pandemic gets under control and we get more information about how good these vaccines work or how poorly they work in immune suppressed individuals.
Or does it mean that the general population might have to keep restrictions in place and mask wearing in place, depending on how big a percentage of the population we're talking about that is immunosuppressed?
Yeah, we don't know. So the population that's immune suppressed is large. It's not enormous, but I think that's where kind of the messaging of all of us, even after we get the vaccine, should still wear masks when we're in a public place or we're in a restaurant or a supermarket or other places where we're around other people. If everyone that we're seeing in our family is vaccinated, including ourselves, and we're immune suppressed, that math starts to change a little bit, or that discussion starts to change, because you know that everyone is vaccinated and protected. But I think when just thinking about the general public, I think that's where we have to really promote still protecting everyone else that's around us, including the most vulnerable among us, which are the immune suppressed individuals.
So things like mask wearing might have to stick around for a long time. And public health officials talk about this, the dangers of COVID symptoms in folks that are immunosuppressed. Is there definitive evidence that, say you are one of the individuals that we mentioned at the top, that you have a higher probability of perhaps contracting more severe COVID symptoms?
There are growing studies and more information about these individuals. And what we are finding is that, yes, individuals who fall in these immune compromised categories are at higher risk of being hospitalized, more severe symptoms from this infection, more likely to be in the ICU. And so we're getting more of that information. And yes, those people are at high risk of developing more severe infection.
Because you see public health officials talking about possibly reopening, getting back to normal in the summer. Might public health officials have to rethink that whole calculus when considering whatever future studies might show about immunosuppressed people?
We might, and I think that's where getting more data is going to help us. I think just even looking at the number of cases and how many of those cases might be breaking through vaccine, or the number of cases that might be due to these variants. So this is always going to be a moving target. And that's why I think you have to be really cautious about setting firm dates or time periods where we're going to get back to normal. I think we have to take into consideration everyone, including these individuals that are immune suppressed.
So much still to learn about COVID-19 and the vaccination. All right, Dr. Michael Angarone, thanks for joining us.
Oh, thank you for having me.